professionals excel in their lives and their careers. It is established by Dr. Akram Ahmed, who is an educationist and a healthcare professional with years of experience across several roles in India, Malaysia, and Australia. Academically offers support to healthcare professionals who wish to upscale their careers by migrating to Australia or other countries, setting new standards by providing preparation courses for the most advanced global healthcare exams. Academically offers guidance, resources, and unwavering support. On your screen is our founder and CEO, Dr. Akram Ahmed. This whole academically is the brainchild of Dr. Ahmed. He is an esteemed clinical pharmacist, distinguished professor, and accomplished research scientist with an impressive 15 years of teaching and research experience in India, Malaysia, and Australia. With a determination to help healthcare professionals across the globe achieve their dream of moving abroad, he started academically. Through his initiative, he provides education and training for pharmacists, medical doctors, dentists, nurses, lab technicians, and physiotherapists for various medical registration exams so that they can move to their dream country. To further support the career advancement of healthcare professionals, he has now launched a study abroad program for those who are wishing to pursue higher education abroad. On your screen is our academic heads, and we have Dr. Rini Sharma. She has recently joined us as an academic head. So, Dr. Rini, are you there?
A very good morning to all of you.
Yeah, so over to Dr. Rini. She will introduce herself.
Thank you, Bharti. A very good morning to all of you. I'm Dr. Rini Sharma. I'm the academic head for medical courses at Academically. So as we all know, the journey to being a doctor is filled with hard work and it requires a lot of perseverance. I wish all of you all the very best for your respective journeys. And we would be glad if you give Academically the chance to be able to assist you with your journey. Since it's a long one and with the right guidance, I am sure all of you will benefit from it. Thank you.
Thank you, Dr. Rini. And apart from Dr. Rini, we have Dr. Alok Semwal as well. He is an academic head for our pharmacy courses. And last but not the least, we have a group of very talented and experienced faculties who help all the AMC students who are aspiring to clear their AMC and be a part of AMC Medical Council, and they want to work in Australia. So today we have Dr. Amit over here with us to share a beautiful class with you. And now I would like to hand it over to Dr. Amit. So Dr. Amit, can you just take it on from here? And I'll just stop sharing my screen.
Yes, madam. Thank you. Thank you very much. I'll just share my screen. Yeah. So very good morning. I hope I'm audible and
yes.
Yeah, and my screen is visible, right? Okay. So before starting, just a very brief introduction about myself. I'm Dr. Amit Desai, and today we'll be taking a short topic in gastrointestinal system. Now, as we know, gastrointestinal system is a very vast system. And most often we also include the hepatobiliary system along with it. All right. So I am trying to take upon a topic which touches almost all aspects of, gives you a small overview of gastrointestinal system, because dyspepsia is something that we see very, very often in our clinical practice. It encompasses a number of, diseases or disorders or problems. And I think with this one topic, we can just give you an overview as to how questions are asked in AMC, how it would be good for you to prepare, in which way it would be good for you to prepare so that, your journey becomes easier. Okay, so let's begin. Now, what do we mean by dyspepsia? Okay, now dyspepsia is something which is the commonest thing that we are going to see when we sit in our OPD for gastrointestinal system. Now there are two types of presentations. Okay, one type of presentation could be people presenting to us with epigastric pain or burning. So people might tell us, that they are having this burning or epigastric pain. The other thing that people might tell us very often is postprandial bloating. So people might say that, when they have their food, they feel very full. Even if the person has had a small quantity of food, that person feels very full, extremely bloated after meals. And many a times there is early satiety. Okay, so there is bloating which gives rise to discomfort, and there is early satiety. So this is what we mean by dyspepsia, and there are multiple causes of dyspepsia. Now that you are sitting over here, you might be thinking that, all right, this is theory. Probably I've learned this in my medical school. I have probably seen patients of dyspepsia while I was doing my internship or maybe some house post in my college. But what about AMC? How am I going to correlate this with the exam that I am planning to give? So let us see what kind of questions can be asked regarding this. Okay, so we will take one sample question because we don't have a lot of time today, but this question we will take and we will try to answer this question by the end of this session. All right, so let us look at this question. A 44-year-old woman comes to you because of pain in her epigastric area for last several months. Now, she denies nausea, she denies vomiting, she denies weight loss, she denies blood in her stool. Upon physical examination, you found that there are no abnormalities. Now, what is the likely diagnosis? The first questions first. Do you think that this is a question of dyspepsia? Do you think that this lady has got dyspepsia? Can you just put it in your chats or in this, whether this lady has dyspepsia or not? Do you think so? Am I not able to see the chat or? All right, yeah. So please put it in the chat. Tell me. Okay, might be possible. Yes, all right. Any other answers? You can be wrong. Absolutely not a possibility. Yes, possible. Yes, 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 yes. Okay, very good. So I'm getting very good answers. Yes, yes, possibly. Yes. So let us see, what do we mean by dyspepsia? We said that there could be epigastric pain or burning. This is one thing that is possible. The second thing that is possible is early satiety. The third thing that is possible is discomfort. So out of these three, what is it that we are getting? What is it that we are seeing just now? We are seeing, out of these three, we are seeing just now that this person has epigastric pain. So one thing is clear, that this is most probably dyspepsia. All right. Now, how do we analyze the rest of the question? We will talk in the rest of the session. But just as a guesswork, okay, see what differentials they are giving us: duodenal ulcer, gastric ulcer, gastritis, pancreatitis, and non-ulcer dyspepsia. So just as a guesswork, can you think of what would you want to answer at this stage, before our class has started, before anything has happened? Yes, anybody else? Yes, yes, yes. Please give answers. You can give, whatever. If you think you are giving a wrong answer, no issues. Okay, okay, yeah, very good, very good, very good, very nice. I'm getting a lot of answers. Very nice. Okay, very good, very good. So, from what I get, no one of you thinks that this is pancreatitis. I don't think any of you think that this is duodenal or gastric ulcer disease also. So it's just two things. All right. Let us see now. Let us see. Basically, what we want to see over here at present is that how do we approach this case of dyspepsia? Because more than anything, that is most important for us. Whenever we get a question in AMC, our aim is how do we approach this question. So first and foremost, we said that this is dyspepsia. But the moment you get a case of dyspepsia in the exam, next thing that you're going to do is try and find out alert features. Now see, they have given you some alert features. She denies nausea, vomiting, this, that. So let us see what is the list of alert features. Okay, so alert features. Now these are the alert features. One is age. One is age more than 55. The second thing is acute symptoms, recent onset of symptoms. That means acute symptoms. Third is pain, daily constant pain. Then there is bleeding. If the person says that the person has vomited and in that vomiters there was blood, what color do you expect that blood to be? Can anybody tell me in the chat what color do we expect the blood to be? What color do you expect the blood to be? If somebody is vomiting out blood, what color do you expect the blood to be? Okay. Anybody else? Try. Yes, very good. Anybody else? Yes, very good. Anyone else wants to try? Yes, very good, very good. That's right. So everyone says, almost everyone says that it will be coffee color. Now, why will it be coffee color? Our regular blood is red in color, right? But we say that this is coffee color. Why? Because our stomach has got acid. That's right, absolutely. There is acid. And so when this heme reacts with acid, it is going to form the acid hematin, which is going to be brown in color, and hence it's going to be coffee brown in color. Absolutely right. Very good. Another thing we are going to look out for is weight loss. Weight loss. See, if we are dealing with something like a cancerous lesion, all right, there is a very high chance that the person will present to us with weight loss. Now, whenever we will see, whenever we talk about dysphagia, inability to swallow, one of the important causes of dysphagia is cancer of the esophagus. And when you read about the cancer esophagus, you will realize that the commonest thing that which the cancer esophagus presents with is dysphagia, that is inability to swallow. But the second commonest presentation is extreme weight loss. So if a person is telling you that there is weight loss, what do we mean by weight loss? If a person has lost a lot of weight, around 10% of weight in 2 or 3 months, which is unintentional. Remember, it has to be unintentional. If a person is going to the gym, if the person is on a diet and then the person has got weight loss, then that is not the person whom we are going to investigate and find out what is wrong, because we know the answer. But if there is a lot of weight loss which is unintentional, or if the weight loss is much more than what would be expected by the gym and by the diet, that is the time which has to ring the bell, and that is the time when we are going to investigate. So weight loss. Another thing is vomiting. Let us call it emesis. And as we said, dysphagia, inability to swallow. Inability to swallow. Then another alert feature is past history of what? Past history of gastric ulcer or past history of gastric surgery. Past history of gastric ulcer or past history of gastric surgery. When you examine this patient, look out for an epigastric mass. If you can palpate an epigastric mass, then there could be a possibility that this person has maybe a cancerous lesion. This person has maybe a pseudocyst of pancreas secondary to pancreatitis. Okay, so this should ring the bell. Anemia. Anemia means that this person is losing blood somewhere. This could be occult bleeding, something which is not being seen, all right? But this is something which has to ring a bell. And non-steroidal anti-inflammatory drugs used. Remember, this is number one culprit. Non-steroidal anti-inflammatories are number one culprit to cause a lot of problems. So when you will study perforation of gastric ulcers or duodenal ulcers, what is it that precipitates that? It is NSAIDs. When you see bleeding from ulcers, what is it that precipitates it? NSAIDs. When you see acute ulcers, acute erosions, what is it that precipitates? NSAIDs. Okay, so this is very important. Now, to make our job easy, let us make a small mnemonic. This is a mnemonic that I use. What do I use? I use a mnemonic called as PA, bled, us, man. Pa, bled, us, man. Okay, let's start filling each of these. All right. P stands for pain, which is chronic pain. A stands for age, that is more than 55 years. The next age stands for acute presentation. Short duration, we said, no, acute presentation. Then P stands for bleeding. L stands for loss of weight. E stands for emesis or vomiting. D stands for dysphagia. US, history of surgery for ulcer or history of history of gastric ulcer or history of gastric surgery. Gastric ulcer or gastric surgery. And examination findings, epigastric mass, anemia, or NSAIDs. These are our alert symptoms. Okay, these are our alert symptoms. All right. So when we see dysphagia, the first thing that we are going to do is look out for alert features. And what are the alert features? Pa, bled, us, man. Okay, history of chronic pain, age more than 55 years, acute onset of pain, bleeding, weight loss, emesis, dysphagia, history of gastric ulcer, history of gastric surgery, mass in the epigastrium, anemia, and non-steroidal anti-inflammatory drug use. If any of these things is there, then we are going to follow a different line of investigations. But if these things are not there, then we follow a different line of investigations. Now, if alert features are there, we are thinking in terms of three important organs. One is the stomach and the duodenum. We are probably dealing with a gastric ulcer or a duodenal ulcer. Another possibility is, okay, let me write these differentials over here. One is gastric ulcer. Second is duodenal ulcer. Third possibility is gastric cancer. Duodenal cancers are not very common, but gastric cancers. All right. Another could be erosive gastritis or pan-gastritis, whatever we are dealing with. So these could be various differential diagnoses. The other organ that we are dealing with is gallbladder and biliary tree. We are dealing with gallbladder and biliary tree. Can you tell me common disorders of gallbladder which can cause this problem? Common disorders of gallbladder which can cause these problems? Anybody? Come on, think. When you think of gallbladder, what is that's right? Absolutely. Absolutely. That's right. So gallstones, cholecystitis. That's right. Cholecystitis can be of various types. Okay. Calculus cholecystitis, acalculous cholecystitis, xanthogranulomatosis cholecystitis. There can be emphysematous cholecystitis, number of them. Of course, like everything, there can be gallbladder cancer, which can cause, there can be cancer of the biliary tree. All right. Those are the biliary dyskinesia. Very good. That is another cause that can cause biliary dyskinesia. Though not very common, but possible. All right. These things are there. Now, the third organ that we are dealing with is pancreas. Now, come on, pancreas. What is the commonest thing that you will see in pancreas? Something that you have studied very, very commonly in pancreas. Yes. Moment we see pancreas, we study only two things, and that's right. Pancreatitis. Very good. This can be acute or chronic pancreatitis. Pancreatitis, absolutely. And the other one is pancreatic cancer. That's right. These are the two important things that we see in pancreas. So, whenever we are dealing with alert features, these three things should come in mind. So, what we usually do is the moment there is alert features, the first and the foremost thing that we will do is upper GI endoscopy. The first and the foremost thing that we will do is upper GI endoscopy. So you have a question. First line of the question gives you or takes you to the differential diagnosis, or rather a provisional diagnosis of dyspepsia. Now the next thing that you want to do is you want to find out whether there are any alert features. Yes, there is an alert feature. There are alert features. So you go along this track. Now the question is, what is the first thing out of these three that you will do? So you will do an upper GI endoscopy. What is the second thing that you will do? Depends upon what the question is. So either you can, after if the upper GI endoscopy is negative, then now either you can try and evaluate GB first or pancreas first, depending upon what do you think the question is telling you. Okay. Now, if you are evaluating GB, the good investigation to do is sonography, ultrasonography. If you are evaluating the pancreas, a good investigation to do is CT scan. All right. Very, very rarely will the question go up to that, where you have to, even the scopy is negative, this, that. But if at all they are giving you a question, they will tell you in the history something which strikes you what should be the next thing. So they might say that there is somebody who is an alcoholic person, has been having alcohol for so many years. There was bleeding, there was something, endoscopy was negative. Now what? So if they've given you history of alcohol, if they've given you history suggestive of risk factors for pancreatitis, then you would next go for a CT scan. Suppose if they've given you something like, waxing and waning jaundice, or pain that comes and goes, colicky kind of pain radiating to the shoulder, or something of that sort, or there's a family history of gallstones, then you would think more in terms of gallstones, and then you would do a sonography. All right. So this is how you approach this piece. Now, what if there are no alert features? Now, what do we do? So now here we have two options. One option is to start PPIs. And the other option is to do an H. pylori testing. So in the subsequent slides, we will see when you will not do a H. pylori testing initially and go for PPIs. And in the other conditions, you will do a H. pylori testing. Okay, so let us look at this. So let us start with H. pylori, Helicobacter pylori, which is a bacteria found exclusively in the stomach. Okay, it's a bacteria which is found exclusively in the stomach. Now, when will you consider an H. pylori infection? So an H. pylori related peptic ulcer should be considered in patients with dyspepsia. All right. Also in patients of gastric cancer or malt lymphoma. All right. You should consider. So remember, what are the lesions which are precipitated by H. pylori? H. pylori will precipitate certain benign lesions and it will precipitate certain malignant lesions. So H. pylori, benign lesions, of course, is gastritis, gastric ulcer, and duodenal ulcer. Whereas malignant lesions, one is adenocarcinoma of stomach. The other thing that it can precipitate is the squamous cell carcinoma of the esophagus. And the third thing that it can precipitate is malt lymphoma of the stomach. What is malt lymphoma? Mucosa associated lymphoid tissue. So in the GI tract, there is lymphoid tissue in the mucosa, and this can give rise to lymphoma. So mucosa associated lymphoid tissue lymphoma, malt lymphoma. All right. Now, it is important to screen for H. pylori infection in any patient who is about to undergo short-term or long-term NSAID treatment. Why? Because we know that NSAID is a very important culprit in causing gastric ulcers and duodenal ulcers. All right. So this is when you will consider H. pylori. Now, let us go slightly ahead. Okay. So this is when you will consider an H. pylori treatment. Now, what if you are in an area where, in a person where the H. pylori incidence is very low, and if there are no alert symptoms, then many a times you can just start with PPIs. You need not do an H. pylori testing every time. Okay. So most of the times what happens is, if you are over here, and if the H. pylori prevalence is low, then you can just start with PPIs. And here, if you find that there is no relief, now you will have to go in for a H. pylori testing. So remember, when you are having a patient of dyspepsia, alert symptoms, if alert symptoms are yes, I'll take your questions later on. The alert symptoms are yes, then you will go and look out for these three things. But if the alert symptoms are not there, then probably you will look out for H. pylori prevalence. Now, why I'm saying this? I'm saying this because this is given in some of the guidelines and charts that are there. Now, in the exam, if this question comes to you, I would tell you that you should mark H. pylori testing. Okay, in the exam, you will have to mark H. pylori testing, because you can't be expected to know the prevalence of H. pylori in each and every area. So in the exam, mark H. pylori testing. All right. But according to the chart, you might go and see some charts somewhere, and there it will be written H. pylori prevalence. Then you will ask me, why did you not tell us about H. pylori prevalence? That's why I'm saying H. pylori prevalence. But in the exam, if this question comes to you, next thing is you will start looking out for options which say H. pylori testing. Now, if this option is not there, then you will say start PPI. Okay, so this is how you will tackle a question in the examination. Now, when will you test for H. pylori? Okay, so test and treat strategy for H. pylori is recommended for patients with persistent dyspepsia who are less than 45 years of age and without any of the following alarm features. So alarm features were the ones that we saw earlier. So if the patient is young, patient has dyspepsia, and patient does not have alarm features, test for H. pylori. So that is what I am saying, that in your examination, if there are no alarm features, then you would look out for an option which tells you test for H. pylori. Now, if this option is not there, then you will look out for an option which says start PPI. Okay, so this is how you make it simple for the examination. But if you are actually practicing, you have to know the prevalence of H. pylori in that particular region. Now, let us see how to test for H. pylori. There are various methods to test for H. pylori. One of the very important one is rapid urease test. Now, what do we use? We use a biopsy specimen, which means that this requires a biopsy. Now, from where do you get the biopsy? You get this biopsy from the upper GI endoscopy. Okay, you do an upper GI endoscopy, and that is when you will get a biopsy. So remember, this thing requires a biopsy. All right. All these are invasive tests, and all these tests will require a biopsy. All these tests will require a biopsy. And how do you get this biopsy? From the upper GI endoscopy. From upper GI endoscopy. Now, this specimen is combined with urea and the pH is measured. Okay, what H. pylori does is it converts urea to ammonia and carbon dioxide. So the test becomes positive for H. pylori. The pH of the medium becomes more alkaline, indicated by color change. So practically, if you see, there are these slides like this. Okay, you will have a slide. Plastic slides are usually there. And there is a medium over here. And this medium, what happens is covered. So what you do is you remove the cover, put a biopsy specimen over here and cover it. And then they give you the time limit. Okay, so they say that, you see this slide in another 15 minutes. So within 15 minutes, if the color changes, if it becomes more pink, indicating that it has become alkaline, then you say that this rapid urease test is positive. When you say that this rapid urease test is positive, a rapid urease test is also called as RUT. Rapid urease test is positive. Now, what are the advantages and disadvantages? One is that it is inexpensive and quick. Another good thing is it is highly sensitive and specific. Okay, sensitive means that from a huge population you will be able to make out those people who are likely to have H. pylori. It is also specific, which means that if it is coming positive, that means most of the times that there will be people who will have H. pylori positive. Okay, so false positives are low. Okay, but it is not suitable for monitoring post eradication H. pylori prevalence. Now, what does that mean? That means that you diagnosed H. pylori, you started the treatment, you finished the treatment. Now you want to know whether the H. pylori has gone or not. Don't use rapid urease. Two reasons. Number one is that again you'll have to do a gastroscopy. Number two is for a long time, this rapid urease will not become negative very easily. Okay. So this is not a test that you will do once you have already given medicines. This is a test that you will do when you want to test the H. pylori for the first time. For the first time. So in the examination, if they give you a question that, this is a person who has dyspepsia, that means epigastric pain or bloating, no alert features. Now what do you do? So you are going to think H. pylori testing. Now they will give you a variety of tests. Which is the first test you would want to do? So the answer would be rapid urease. Okay, so they might give you options like rapid urease testing, culture, histology, other things also, breath test, etc. So in that case, you will choose rapid urease testing, because first time when you want to check for this H. pylori, you have to do rapid urease. That's the best. The other one is culture. So you take the biopsy specimen, put it in a culture medium and culture the organism. Problem is, it is expensive. All right. It is not widely available. Though it is highly specific, it has a low sensitivity. So if you want to quickly detect who amongst the population is having this test is not very good. But it is highly specific. The very fact that you can culture the organism means that this person is suffering. Okay. And that is what it means. Very low false positives. Histology. The advantage of histology is that not only will it detect the H. pylori, it will also detect if there are any changes of dysplasia. Okay, so if there are changes of Malt lymphoma, it will be detected. These are all invasive tests. So this is also going to require gastroscopy. Right? Now you come to non-invasive tests, tests which do not require gastroscopy. These are tests which do not require gastroscopy. All right. So one is serology, of course, to find out antibodies, IgG antibodies. All right. Very easy to do because you just have to take blood and send it. So it is inexpensive. It will be widely available. All right. How do you interpret it? So if it is positive, but if it is in low titers, then it indicates that it was a past infection. Whereas if the titers in high titers, then it indicates active colonization. So if the serology is positive, low titers indicates past infection. Whereas in high titers, it indicates active infection. Active infection. All right. Now the problem is that these IgG levels are going to remain in the body for a long time because that is their job, right? To create memory. So if you want to do this test to find out whether you've eradicated H. pylori or not, it is not a very good test. Next test, we come to urea breath test, UBT. All right. Now, what happens is it uses the principle of urea metabolism. Okay, so patient will ingest radio-labeled urea and they will measure the isotope labeled carbon dioxide which is being exhaled, and that is why it is breath test. So urea because radio-labeled urea, and breath test because in the breath whatever carbon dioxide is exhaled, they will try to find out how much of it is radio-labeled. Now, what is the importance? It has a high positive predictive value, which means that if it is positive, that means your H. pylori is still there. It has a high negative predictive value, which means that if it is negative, that means the H. pylori is gone. Remember, for a clinician, positive predictive value and negative predictive value are very important. For an epidemiologist, sensitivity and specificity are very important. All right. So this is the test which is suitable for post-eradication monitoring. For post-eradication monitoring, which means that if you have given treatment, if the question says that you've already given treatment, now you want to find out whether H. pylori is there or not, you will do this test. So when you are doing for the first time, you will do a rapid urease test. But after the therapy is over, you want to check whether you have eradicated or not, then you will do a urea breath test. Okay, that is what you will do. Now, once you have diagnosed it, you have to treat it. So what are the various therapy regime? Okay, so you have triple therapy, quadruple therapy. Then we will also study things like sequential therapy, etc. So most of the therapies have got one PPI. PPI are proton pump inhibitors. What do they inhibit? They inhibit the proton pump, that is the hydrogen potassium ATPase pump, which is the last step in acid formation. So whatever may be stimulating the acid formation, if you block this, the acid formation is going to be blocked. So which ones can you use? Either you can use S-omeprazole 20 milligram twice, or you can use omeprazole 20 milligram twice daily. Along with that, you will use two antibiotics. Okay, two antibiotics. Which are the two antibiotics that you will use? You can use amoxicillin 1 gram twice daily, or clarithromycin 500 milligram twice daily. Okay, so PAC kind of regime you can use. Now remember, this is the first line recommendation in Australian guidelines. Okay, have this in mind. So when you start treatment, you will always start with this. How many days you will give? You will give a 7-day course. All right, and there are prescription drugs available. Okay, so you can either come like Nexium HP7 or these are the brand names. You have something called as quadruple therapy. Now, quadruple therapy, what will you add? Along with these three, you will also add bismuth subsalicylate. Okay, bismuth subsalicylate. Now, remember, this can be given as a 7-day course, or this may even be given as a 14-day course. Okay, 14-day course. Now, when will you use it? If you know that an area has clarithromycin resistance, because here we are not using clarithromycin, here we are using metronidazole. So if you know that this area has got clarithromycin resistance, that is the time when you will use a quadruple therapy. So, all right. So when you are dealing with H. pylori, you have to start the therapy. Now, you will see whether there is any clarithromycin resistance. If it is no, then you will start with triple therapy. And if it is yes, then you will start with quadruple therapy. All right, so far so clear. All right, then we go to what is known as the sequential therapy. What do? It's a two-step therapy. So it is a 10-day program which is divided into first 5 days and the second 5 days. So for the first 5 days, we will give PPI plus amoxicillin. And in the next 5 days, we will give PPI plus clarithromycin and plus tinidazole. Okay, so this you will give. All right, so that it's a you are using multiple antibiotics. So even if something is resistance, the other thing will be all right. Now this, as you know, would not be used as a first line of therapy, of course. Now then there is something called as salvage therapy. What do we mean by salvage therapy? That in spite of using all these things, some patients do not respond. So in that case, you will give salvage therapy where you will give PPI plus amoxicillin plus levofloxacin. Now see, new drug is added, levofloxacin, for 10 days. Okay. So if this is not responding, then you will give a salvage therapy. So see, this is what it is. Okay. So you have first and second line therapies. So first line therapies are usually these ones where we are giving PPI plus clarithromycin plus amoxicillin. This is given for 7 days. The other 7-day one is the PPI plus clarithromycin. PPI plus clarithromycin plus metronidazole, again for 7 days. The third one is PPI plus bismuth subsalicylate plus tetracycline. This you will give for 14 days. Because see, here you are giving only one antibiotic. And this is the sequential therapy where you are giving P plus A for 5 days. And we are giving P plus C plus T for another 5 days. All right, so these are first and second line therapies. First line ones are those, as we said, the triple therapy or the quadruple therapy. Then we go to the third line therapy. Third line therapy is either you can give PPI plus bismuth plus furosemide plus tetracycline, or you can give bismuth plus amoxicillin plus rifabutin plus ciprofloxacin. Okay, these are the salvage therapies or rescue therapies if your regular therapies are not working. Now the question is that when do we do post-treatment testing of H. pylori? All right, when do we do post-treatment? So there is an American College of Gastroenterology guideline which says that people who have H. pylori associated ulcers, in these people you should do a testing again after the treatment is done. If a person has early gastric cancer. Remember, what is early gastric cancer? When the gastric cancer is confined to the mucosa and the submucosa. Okay, it has not yet gone to the muscularis, then it is called as early gastric cancer. The importance of this is that you can do an endoscopic resection of these early gastric cancers. Now, many a times we know that H. pylori is a risk factor for early gastric cancer. So we would want to have an eradication of H. pylori. Now, in this case, you have to make sure that this H. pylori has gone. Similarly, the other cancer, malt lymphoma, if you're treating malt lymphomas, very, very early malt lymphomas can be treated even with just H. pylori eradication. Nowadays, there are papers which say that, okay? So in that case, you have to make sure that the H. pylori has gone. And if you have a person whom you have treated for dyspepsia and still this person keeps on returning with the problems, with the symptoms, even after treating H. pylori, now this is the patient where you have to do post-treatment testing. And what will you use for post-treatment testing? Please put it in a chat. Tell me what investigation you will use for post-treatment testing of H. pylori. Which one? That's right. That's right. That's right. So you will use, very good, urea breath test is what you will use. You will use urea breath test. Now, in the exam, if you are asked about H. pylori treatment, follow this order. So first and foremost, you start with education and lifestyle modification. Okay, weight reduction, cessation of smoking. So all these things, okay, so that is the first thing that you will definitely do. Avoid reduction of alcohol, reduction of smoking, avoid fatty foods. Okay, avoid coffee and alcohol at night. Now, why is it that I'm saying stage 1? You will tell me, this is a person who has got H. pylori, and still you are telling that stage 1 is education, this, that. Remember, in certain questions in your exam, they have asked you that what dyspepsia, no alert symptoms. Okay, so now you have to go in this H. pylori direction. So what they will tell you is, like, they will give you history of dyspepsia. There is epigastric pain or bloating. There are no alert symptoms. So the age is, say, 35 years of age. There is no bleeding. There is no weight loss. Nothing they have given. And now what is the next thing that you will do? And nowhere have they mentioned about H. pylori testing. Nowhere have they mentioned about PPIs. Okay, they have mentioned something really very complex. And one of the options that they've given is this lifestyle modification. So that is the time when you have to take this lifestyle modification. All right. So it is not, I'm not telling you that, if there is H. pylori, forget about H. pylori and just keep giving lifestyle modification. This is also to be done. But why I have written this as stage 1 is because in certain exam questions, the option is only not there. The option is only educate and lifestyle modification. So in that case, you will mark that option. Okay, because this is also one of the ways of treatment. Avoid fatty food, reduction, cessation of coffee and tea, chocolates, avoid coffee. Okay, at least 3 hours between the evening meal and retiring. Small regular meals and snacks. Okay, sleep on the left side. Avoid certain drugs like doxycycline, calcium channel blockers, iron sulfate, steroids, NSAIDs. All right, you can use antacids and elevation of the head end of the bed. Then you give the triple therapy or whatever. This is the sequence that you are expected to. So now we come back to the question where we started. So many of you have given me the right answer. Can you now tell me again what do you think is the answer of this question? That's right. That's right. Okay. That's right. So it is non-ulcer dyspepsia. Why do we say that? Because see, patient who has gastric ulcer is more likely to present to you with pain which is worse with food. A person who has duodenal ulcer will present to you which is with pain which is better with food. Why does this happen? Because in gastric ulcer, the food is irritating the ulcer, and that is why there is pain. Whereas duodenal ulcer is mainly because excess acid secretion. So your food is going to neutralize the acid and going to cause less of pain. That is why you see people with duodenal ulcer have a better appetite and tend to gain weight. Whereas people with gastric ulcer have a poorer appetite and tend to lose weight. All right. So weight loss is seen with gastric ulcer. Now cancer, just remove this. Okay, cancer has nothing to do with gastric ulcer. That's a different story. Pancreatitis, pain in the epigastric region which radiates to the back. Pain in the epigastric region which radiates to the back. And why does it radiate to the back? Because pancreas is a retroperitoneal organ. Okay, so that is why. Then bad taste, sour, water brash as they call it, sour taste, cough and hoarse voice is suggestive of gastroesophageal reflux disease. Diabetes and bloating diabetes is a risk factor for gastroparesis, and these people will present with bloating. Now, when you have nothing of that, one of the options was gastritis. Gastritis presents very much similar like gastric ulcer, and many a times in gastritis, which is very severe, there might be blood which is vomited. All right. So when you have nothing of this, then there will be non-ulcer dyspepsia. Okay, non-ulcer dyspepsia. So, yeah. Any questions from your side? I think today's topic is over. Any questions from your side? There are people who have raised the hands. I don't know how to. Can somebody just help me by?
Yes, sir. They can just raise their hand or just write the question in the chat box. So, Dr. Vishnu, is the question from the recently taken topic? You can just unmute yourself and ask the question.
Yes, doctors, please unmute yourself and ask the question to Dr. Amit. Or if you have any questions to me regarding anything else, like maybe
Yes.
regarding the course or maybe the job, visa, or anything about Australia, you can also ask.
You can unmute yourself and please ask. Yeah, Dr. Hiba, we will take on this academic query first related to the topic that has been told right now, followed by... Yeah, so anyone have any question related to the topic that just now is covered by Dr. Amit? You are most welcome to unmute yourself and ask the question.
Hello, ma'am. I want to ask a question. My question is, what about the control of bleeding in cases of, in such cases where one of the arteries is in the stomach and the present?
Okay, so as far as bleeding is concerned, see, bleeding comes under emergency. So any emergency, anything which is an emergency, we will always control number one with the A, B, C, D, E. That's the first and foremost: airway, breathing, circulation. In bleeding, we'll require to control circulation before we do anything else. And that once that ABCD is under control, we have got two large bore IV accesses. Once we have taken blood for cross matching, once you have started IV fluid, now the next thing that we need to do is we need to give antacids. Now, question is, you said that there is an artery which is bleeding, right? So what we need to do is we need to do an endoscopy. With endoscopy, one thing that we can do is we can inject adrenaline in and around. Because in the stomach that is there, if it is bleeding, we can inject adrenaline. If it is not working, then we can even clip. Okay, we can even clip the artery over there. And if none of these things are working, we can take up for surgery and underrun the artery. Most of the times, endoscopy works nowadays because we have got good endoscopic instruments. But if that is not possible, then we will have to underrun the artery by taking the person in surgery.
Okay, thank you very much, sir.
Yeah. But it always starts with ABC. Okay, so in the exam, if the question is asked, first is A, B, C, D, E. airway, breathing, circulation, any emergency.
Okay.
Sir, can you just summarize the treatment once again? Just summarize the treatment.
Treatment of H. pylori or treatment of dyspepsia?
Treatment of H. pylori.
H. pylori. Okay, so H. pylori, see, this is the chart that I'll show you, the treatment. So H. pylori, there are two things. One is in general, when we treat anything, first and foremost, it has to start with education, okay, lifestyle education. So first it will start with lifestyle education. This is for our patients who are coming, okay, because lifestyle education is the first thing. Second thing is avoid the offending agent. And the third would be to start drug therapy. All right. Now, when we talk about drug therapy, we will see whether this area that we are talking about has got clarithromycin resistance or not. If the clarithromycin resistance is not there, then our first line of treatment as per Australian guidelines is a triple therapy. Triple therapy where we use esomeprazole, where we use amoxicillin, and when we use clarithromycin. If we are dealing with an area, if they tell us that this is an area which is known to have clarithromycin resistance, then you will not go for triple therapy, you will go for a quadruple therapy. Esomeprazole, bismuth, and metronidazole. Okay, this is quadruple therapy. Both of these can be given for 7 days. Quadruple therapy can even be given for 14 days. Now, if they give you in the question saying that we have already given quadruple therapy, but it's still not working, then we go for what is known as the salvage therapy, where we add another antibiotic along with amoxicillin. All right. Some areas they would want to give a sequential therapy. For first 5 days, they will give PPIs plus this amoxicillin, and then PPIs plus tetracycline and clarithromycin. All right. But as far as guidelines are concerned, first line is triple or quadruple.
Okay. Okay. Thank you.
Okay. Anyone else who has any question related to the topic that has been taught just before? Okay, so I think Dr. Amit, we can wind it up at your end. Thanks
you.
for such an informative session.
Yeah,
And you can just unshare your screen. And following this, do you have any other queries related to the AMC course and anything that Dr. Akram can help you here? So you are most welcome to raise your hand or just write it in the chat box. And Shoaib, now you can just share the screen.
Madam, can I log out?
Yes, sir. Thank you.
Thank you.
If anyone has no query. Thank you, sir. Thanks a lot for joining us.
Thank you very much.
Thank you, Dr. Amit. Thank you so much.
Sir. Thank you, sir. Thank you.
Okay, so rest of the participants, you can just raise your hand or yeah. So we have Athira Ajay. Athira, you can just ask your question by unmuting yourself.
There is some student asking regarding the course. Okay, so right now, the guys, is a good news for you. We are giving up to 50% scholarship. Okay, so please, we already share here this scholarship test. Please to attend this test. And regarding your, based on your performance in that test, our team will guide back to you and they will offer you the scholarship. You know, so avail this scholarship, and I have already given in the link in the chat box. So please attend the test here, and based on your marks, you can secure the scholarship.
Yeah, so it was a query by Dr. Hiba Imam. So Dr. Hiba, you can just attempt this scholarship test. Right above your chat, the link is shared by Dr. Akram. So just click on the link. You can copy the link from here as well and attempt the scholarship test, and accordingly our team will connect with you. Apart from that, just leave your details over here. Dr. Priya has also asked, do we have any masterclass on internal medicines? So Dr. Priya, I think this was a masterclass for this session.
I think Bharti, 2-3 पहले भी masterclass हुई थी, available on our YouTube channel. So Dr. Priya, you can go to our YouTube channel. You can find there these topics. And in future also we are going to get some more internal medicine related topics.
Masterclass. Yes. Apart from that, if you have any other query, you can ask. Taleem Khan, ma'am, I'm new here. Please tell me about AMC. So it's an Australian Medical Council exam that you need to clear for practicing in Australia. So can we hear from you, Doctor, first? Dr. Taleem Khan, can you just tell us about yourself?
So we provide coaching for AMC1, AMC2, both exams. Okay. So if anyone want to practice in Australia as a medical doctor, want to do PG in clinical branch in Australia, you need to pass these both exams, AMC1 and AMC2. Or there is another pathway called WBA pathway, PESCI pathway. So there is so many things. So if you are one of the medical doctor, MBBS or आपने किया and want to do practice in Australia, so we can help you. This is very brief about the AMC exam.
So some queries are in the chat box. If you can just address.
Dr. Chetan, yes. So if you can clear part 1 exam, there's a very good chance you can work as a SRMO. Last week we have, I have done one interview with the Dr. Priyanka. She done Ops and Gynae from India and MBBS MD. And then she got this job in the first attempt.
Okay.
भैया इधर हाँ बोल तो रहा हूँ आपको यार. So yes, I mean, if you can clear AMC1 and English test, then there's a very good chance to get a job in your own field. Yes, after AMC1, you can work in Australia. So Australia is the only country in the world they allow us to practice, after part 1. But you are not allowed to practice independently, but you need to work under supervision. Okay. But yes, you are allowed to work in Australia after part 1. AMC1 plus English, if you can clear, you are eligible to work.
Dr. Priya, you can just leave your details. Our team will contact with you regarding the live course
Yes,
and the recorded
if
course.
you done some observership or maybe some research, publications, obviously it'll improve your CV, especially when you are applying your PG in Australia. So the exam fee around 2,923 Australian dollar, around is going to be around 1.5, 1.6 lakh Indian rupees, around the exam fees for AMC1. So if your university not yet recognized by ECFMG, please contact your university so they can contact ECFMG to update there, so we can't help in that. AMC exam is easy. I can say it is very easy exam. There's so many students from India, they are not able to clear FMG exam, but they clear this AMC exam in part 1 in the first attempt. Okay, so there is no, once you pass part 1, you are eligible to write part 2 exam. So there is no such a gap time, but I think at least 3 to 5 months, if you can prepare yourself for part 2 exam, it's a good time to go within 6 months basically once you pass part 1. So guys, I think our team will get back to you. You guys are asking very basic question. Guys, please directly you can unmute and ask the question.
Yes, Dr. Athira, we can just take up your query. Kindly unmute yourself and ask the question. Followed by Dr. Mohammed Omar.
Yes. So if anyone passed already, if any doctor want to practice in New Zealand, and if you already clear USMLE part 1 and part 2, so you are eligible to write this NZREX exam, and we also provide coaching for this. Okay. And once you get registered in New Zealand, in future, if you want to migrate to Australia, you also can. So please get in touch with us, Dr. Raghav and Alex Matthew. How many years since you academically started? Was your I am the last 10 years I'm guiding the student. You can watch my YouTube videos. Last 10 years. I'm living in Australia basically. And I'm helping healthcare professionals to migrate to Australia last 10 years. But academically, we started last 3 years back. Okay. So we have so many students pass from academically. It is academically the healthcare attack. So we provide courses for medical doctors, dentists, pharmacists, nurses, physiotherapists, optometrists, and we have very good success rate. More than 80% students pass in their first attempt. And this is also is up to the candidate, how they are preparing, how much they're given the timing, and all those things also depend. But if you can study around 4 to 5 hours per day minimum for 4 months, you can clear this exam. There's so many students already passed this exam within 4 months and 5 months and so on.
Thank you, Dr. Akram. Alex here. I had asked you the question and just wanted to. Hello, am I audible?
Yes, Dr. Alex.
Yes, you
Yeah.
are
So
audible.
we have been with Academically for the past 4 to 5 months now, and
Okay.
I must say that Bharti ma'am is really helpful. I have spoken to you, Bharti ma'am, if you remember, but there are many students.
Thank you.
It's
Yeah,
okay.
yeah.
Yeah. So it's been a great help, and the journey has been good. So wanted to share that, and just
Okay.
wanted to
Thank you,
check.
Dr. Alex. Yes.
Yes, sir. Thank you for answering the question, sir. And I had one more question, which I wanted to know: how does Academically ensure that the material is updated with the latest AMC?
Yes, so we
Year
have
on year. How do
faculty,
you?
all 90% faculty of academically, they are basically AMC qualified. They are practicing in Australia. Okay. So anyone practicing in Australia, they must, up to date their guidelines. So we have a backend team. The faculty always give the input, and we need to change the syllabus, or not the syllabus, I mean the content. So we always, before we start any batch, any new batch, always we content update करते हैं हम लोग. Whatever is there any new guideline, or sometimes if not, so then we give the link or the guideline to the candidate. Please read this before you go to exam. So we are basically up to date, whatever the latest things to go to pass this exam.
Thank you. So, and just one more question. Just wanted to know what are the most common mistakes candidates make in the AMC1 exam, and how do you help students to avoid them?
Generally, student Bharti, if you can take this question, but generally student
Sir, I
they
think
are in Indian. So Indian student, they think that the syllabus is the same, and they are doing preparation here in India from dams or marrow or here and there. They are thinking and they are preparing basically for NEET PG. So they think that we can also pass AMC. So sometimes candidates preparing for 2 exams, not just one. So please focus on one exam. AMC.
this is
If you
the,
can
yeah.
give
Sir,
4 months.
I like to add.
Yeah, Dr. Inni.
Yeah, hi. So, Dr. Alex, I think you've raised a very valid point, and I just wanted to address it since a lot of students would be benefiting from it.
Thank
So,
you,
I
ma'am.
think the most common concept that needs to be cleared here is that the students first who are going in their AMC journey, they need to understand what AMC is all about, and how it is different from NEET. In respect to that, it is a very clinical oriented exam. If you have gone through some of the questions, you would have known by now that the questions are 5 to 6 liners, and a lot of time they are not asking anything about rote learning. You can't just mug up and go and attempt the AMC. You need to have your concepts very clear, because a lot of time they are doing what is known as like reframing the question, and they would be asking you for things like the next best step or the best management, or what is the best outcome with respect to the clinical scenario which they are asking, and the clinical scenario varies from case to case. So usually when we are encouraging our students, we always tell them to go in for in-depth understanding of the concept, because if you know the concept, no matter how they frame the question, you would be able to attempt it. And the second thing I would want to stress on over here is time management. Since the questions are very long, you have to train yourself, to read the question in a limited amount of time and then attempt it. And like if you're not able to answer the question in 1.5 minutes, try to move to the next question so that you are able to complete the question, all the questions, 150 questions. So I hope this helps.
Thank you so much, ma'am. Yeah, it did throw a lot of light on it. Just one more question. How does academically select high yield questions or topics? Just wanted to know that.
Okay. So for the high yield questions and topics, like Dr. Akram has said, all of our faculties working right now in Australia, they are AMC qualified. So during the lectures also, they point out to the students, what are the high yield topics based on the questions or the topics which have been repeating consistently in the past, 5 or 6 years. With respect to repeating, I don't mean the same question. I would like to again emphasize, because questions are never repeated. It is generally the topic. Like there are some topics which are very, we call them like cash questions. Like usually you will always have a question on ECG, always have a question on osteoporosis in one form or the other. And then maybe a question on DVT in pregnancy. So faculty is usually very well aware, and also like our students, they come back and give us the feedback to, if they saw anything new in the question. And based on that, our team frames these high yield topics, which we have on our system for the students, particularly to, go and give it.
Thank you.
So hope this helps. Yeah.
Yes, ma'am. And if we are struggling with any particular topic, can we do a one-on-one with any faculty, or how do we solve it just in case? For example, ECG reading is difficult for me. So if I struggle with that, is there any other assistance that I can get, or?
Okay. So, like, if any particular topic you feel that it is difficult, I would suggest go through the PPT once again and maybe like try and, read the latest guidelines and try and solve as many questions as you can. But if after all that also you feel that you have a difficulty, no worries. Our team is here to help you, and sure, we can connect and see, how we can help you with that.
Thank you. Thank you so much, ma'am. Great answers.
Hello, good
Welcome.
afternoon, ma'am.
Yeah,
Hello,
hi, good
good
afternoon.
afternoon, ma'am.
Good
Ma'am, Yukta
afternoon.
this side.
Okay. Yes.
Ma'am, I wanted to know that in this January only, I have cleared my FMG, but my university is not recognized by ECFMG. So, if I complete my internship from India, can I apply for AMC, or I'll be needing ECFMG registration even after my internship?
Yes, आपको still need रहेगा ECFMG का, because they want to check कि आपका university approved है नहीं है. So please contact your university and they can request to the ECFMG to add their name if they are approved university. Are you from which where did you MBBS? Which country?
Sir, I have cleared my MBBS from Kyrgyzstan. Like I was earlier, I was at Ukraine, but because of war, I took transfer to Kyrgyzstan.
Okay. I think जहाँ से आपको फाइनल डिग्री मिला है ना, वो लोग को they can write to the ECFMG.
Okay, sir. Sir, there was confusion because some were saying that I can apply for AMC after my internship. But okay, I'll be needing ECFMG.
Yes, anyhow you need ECFMG अगर आप इंडिया से बाहर जाना चाहते हो, ठीक है?
Oh, okay, sir. Thank you very much.
Thank you.
Akram sir, I have one more doubt to ask you specifically. Alexia, if, for example, I clear AMC 1 exam and I, all goes well and I get the initial job, and then if I attempt the AMC 2, can I again go back to a hospital? If I fail in AMC 2, can I again go back to a hospital and who offers a work-based assessment? Can that be done after a failed attempt?
You can. Basically, you can even try for both simultaneously. For example, if you fail in AMC2 and you are applying for WB, even before also you can try. And generally, they give the preference those have at least 1 year experience after MBBS in WB.
Okay, so thank you. And that can be done simultaneously. And is it easy to get a work-based assessment? Because I've been hearing it's difficult
It's
to
not
get.
easy. I mean, there are 23 hospitals, right, for a WBA. And now all our IMGs are competing for these positions.
Oh, so among 23 hospitals, there are only 23 positions all over Australia.
Not in one. I mean, in each hospital they might have 5 or 10. Sometimes they have. But if you have experience, at least more than 1 year, then it's easy for you.
So what I'm trying to ask here is, are there only 23 posts the
It's
whole of
only
Australia?
it's not only 23 hospitals approved by the government. So in these hospitals only you can apply for WBA.
Okay, any count that you know, sir? Like how many are present or
No,
anything?
so they are not. So they vary always.
Okay, okay. So there can be a few hundreds also availability.
Yes.
Thank you, sir. Thank you so much.
Thank you.
Hello, hello,
Yes,
hello.
Dr.
Am I audible?
Satyasuri.
Yeah, thank you.
Yes, hello, Dr.
Actually,
Satyam.
yeah, I'm a pulmonologist and I'm a senior citizen
Rest of the
also.
participants,
I've
kindly
been,
keep yourself on muted setting because it is the disturbance. So now, Dr. Satya, are you asking?
yeah, I'm asking. I'm
Okay.
actually practicing pulmonologist for the past 33 years. Actually, I'm retired. I mean, like, I'm senior citizen, 61 years old. My daughter is settled at Australia, Brisbane. So I want to come over there and do practice. Actually, I'm very good clinically. Like the lecture I have listened, almost 90% of the questions I can answer. So how to go ahead about that? I really don't know about the academy. Recently only I just want to know. So can you guide me? I mean, how to approach and can I practice at Australia? No, but at this age, I mean, I'm 61.
No, I mean
Hmm.
there is no visa after 45 generally in Australia.
Okay. And if my daughter responds like, I mean, she's a citizen now.
Um, you know, she can basically, she can sponsor you. So she need to talk some consultant in Australia. But as like medically, we can help you to get registered in Australia. But in visa, we can't help you.
Medically, yeah, I can be registered.
Yes, you can. You can sit
How
in the
by
exam. You
writing
can pass the
exam or
exam,
what?
and you can
Huh?
register. If your daughter is there, she can help you in the visa. So in that way, you can work there.
So I have to write exam or without exam?
No, no,
Like
you
how I
must.
can practice? That's what I'm asking.
Yes, you need to write the exam. But
Okay.
have you done your MD or MS in India or
No,
MBBS in
I
India?
did MBBS and DTCD from Nagpur.
Okay. In that case, you need to basically pass this exam or part one exam at least you need to pass.
Okay, part one I had to pass. But now I can't apply. I mean, like once I go there, then I have to apply, or I can
No,
start applying.
now you can apply, start your process. So there is a documentation process, an exam,
Hmm.
all those things you can
Hmm.
do in India. I'm just talking about the visa. आपका age 61 हो गया है, so we can't help in the visa, but we can
Yeah,
help you to get
it's
registered yourself with the AMC.
okay. Okay, thank you so much. I
Okay.
mean, already I worked abroad at many places, but anyway, okay, fine. So, thank you. Okay, thank you.
So, any other question?
Dr. Inni and Bharti, you can take care. ठीक है? I'm just leaving.
Yeah,
Okay,
hello.
sir.
यहाँ
Yes,
Good morning, Mr. Sharath here. Actually, currently I'm working in a government setup right now since 3 to 4 years. So I'm looking for AMC. So
Yes,
what are the
this is
chances?
perfect 100% Dr. Rashmi. If you can just pass AMC 1 plus English, then you can
Yeah.
go to the pesky pathway. You no need to write AMC 2 exam.
Okay. Actually, my wife is anesthetist. She completed anesthesia PG, and she is also looking for. So can we parallelly apply both together?
Yes. I mean, once you got the visa, your wife will be dependent on you. Both
Okay.
of you can apply. So
Okay.
basically, anyone will got the visa, the other person can go as a dependent.
So her PG is recognized there, or she should do any other courses there?
No, I mean, she need to do some other courses, but she need to go for this AMC journey.
AMC pathway. Sure. Thank you.
Okay, thank you so much.
So can I ask a question? I want to know that since you are living in Australia and you are well versed with the medical system over there, I'd like to know what is the possibility of doing specialization over there after completing clearing all my exams and getting registered as a medical officer there and working for 1 2 years. Thank you.
Yes, so there is a good chance. I mean, this is purely based on your CV and your or your previous experience. So if you have some working experience in India, so there's a very good chance to get into the PG. And this is also based on the which branch you want.
Okay, so since I have completed my junior residency in for 1 year, I've done in radiology, and 1 year I did in pulmonary medicine. So right now I'm looking for AMC and looking forward to clearing the exam. So, but for me, getting specialist degree is very important. So I was thinking is there any entrance exam in Australia just like on
In
the?
Australia, no entrance exam. It's purely based on your CV. They will call you for the interview.
Okay, okay, and how do I apply it, sir?
Yes, we
For
can help
example,
you. I mean, just wait. Our team will get back to you and they will guide
yes.
you the entire process.
Okay, thank you very much, sir.
Yeah, so Dr. Shami, you have already enrolled with us. As per my
Yes, ma'am.
information, you are
Yes.
already an enrolled student. So you can just connect with me. I'll help you with the questions.
Okay, okay. Thank you, ma'am. Thank you very much.
Thank you.
Sure. Yeah,
So
Dr.
anyone
Sharath
who
here.
is not actually the enrolled student can ask the question. Rest of the students can directly connect with me. I'll definitely help them with the query.
Yes, yes, ma'am. So, Dr. Sharath here. Will you people also help us in building our CV?
Yes, after you clear the exam, definitely we'll have a one-on-one session for those who have cleared AMC Part 1 and will guide you with the CV writing.
So, end to
And
end.
that can
So,
be
right from
reviewed later.
start, you people will help us till we get a job, right?
Yeah, we will guide you about the opportunities
Okay.
and we will guide you about the CV writing.
Hello, am I audible?
Yes.
Ah,
Dr. Rini, are
I
you
wanted
there?
to ask.
Yes, Bharti,
Uh,
yes. Yes, doctor.
I wanted to ask if we finish the AMC one classes of academically. So when do you suggest that we take the exam? Like within how many months? Like what do you suggest?
So, doctor, are you currently enrolled with us?
Yes.
Okay. And are you done with your batches? The sessions?
Uh, no, I the classes are all uploaded. I'm still watching the classes. I've not finished it
Okay.
yet.
Okay. So I think when you can actually appear for the exam is very subjective. It depends upon your confidence and your preparation level. But I would suggest that once you are done with the sessions and you've gone through the questions, the mocks, plus you've covered your blue book and the red book and the latest guidelines. If you feel you're ready, you can attempt our grand tests and see how you feel about it, and then you can go ahead and book your exam.
Assalamualaikum, ma'am.
Okay. Thank you. Thank you. Thank you, ma'am.
Hello, ma'am.
Hello, madam. It is Prakash from India. Can you hear
Yeah,
me?
hello, doctor. Yes, Dr. Prakash. Yes.
Yes, ma'am. The thing is, we'll be clearing AMC Part 1. Will you assist us to get a job in Australia?
See, doctor, after you clear your AMC 1, our team does help you with, CV writing. We connect you with our mentors, and also you have a session with the faculties who will be guiding you with the further steps ahead. And we can guide you like where to look for jobs, but we do not guarantee any jobs per se. Like, I mean, we don't like find jobs for you and tell you that, you
So
can
your
get this
academic,
job. Yes. Sorry, I didn't get you.
academically, yes, ma'am. The academically institution it only focus training doctors for the exam. Is it like that,
I
or
mean,
what
like
else you provide
we
for the?
we sup- uh, we support you with the respect to the academics, your CV building, and also your visa queries, your documentation.
Okay.
We'll help you in, we
Yeah.
will provide you with the website links and where you can apply. And we have recently started with Jobsly as well. Arindam, are you there? Okay. So we will guide you the
Okay.
possible.
Okay. Another question.
Yes,
Another
yes, I
question
will.
is like. Another question is like. Um, Clearing AMC Part 1, do you have any offline training?
Sorry, doctor, I didn't get you. There's
Offline
a
training
network.
centers, not the online one, the offline training center. Do you have any which we can stay? We'll provide teachers. So the 4 months coaching.
In India?
Yeah.
No, right now, doctor, we are providing like this online assistance in India.
Okay. That's it. That's my questions. Thank you.
Thank you. And you can just, leave your contact details. And if you want, like our counselors can connect with you one-on-one. And if you have any other queries, they'll be happy to assist you.
Okay. 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 Thank you.
Hello, ma'am. I'm Dr. Pragya. Can you hear me?
Yes, Dr. Pragya.
Yes, ma'am. Ma'am, I have done my DNB pediatrics and I'm having 2 years of experience in pediatrics. So I have to clear AMC exam or I have another option of joining there in Australia.
So, hello, doctor. You said that you have done DNB pediatrics and you have 2 years of experience.
Yes, yes, ma'am.
Okay. So, ma'am, you have to give your AMC. You have to go down the AMC. So you have to give your AMC one.
Dr. Viraj, if you can mute yourself. Thank you. Yeah, Dr. Rene, please.
Yes,
Yes.
ma'am.
So, doctor, yes, you have to go through the AMC pathways and give the AMC exam.
Okay, ma'am. Then after I can apply for job there, no?
Yes, after that, but you will have to go through the AMC exams, and then maybe if you like want, you have 2 years of experience in pediatrics that you're saying,
Yes,
and
yes,
maybe
yes.
after you clear your exam and you land a job, this 2 years of
Mm.
experience you can show in your CV, and
Okay.
there you can once you start a job, and this 2 years of experience can be counted, and depending on your CV, maybe you get a job into the pediatric department or any other department. It will depend upon your complete CV, but to begin with, you will have to give the AMC exam.
Okay, ma'am. Thank you.
You're welcome.
So, Dr. Rakesh, you can just unmute yourself and ask your question. As I can see, you have raised your hand. Dr. Vineet Jansali.
Yes,
Dr.
ma'am.
Faika. Yeah,
Hello.
please.
Am I audible?
Yes, you're audible, Dr. Vineet.
Yes, I had one query that I'm just completing my internship in India now, like in 2 months. So how can I prepare for AMC? Should I gain more experience, work for 1 year in India, and then apply, or should I just apply then and then, like start preparing from now onwards?
So, good afternoon, Dr. Vineet. I think since you mentioned that you're just doing your internship, I think this is a very good time to start your preparation because right now, you are fairly new and fresh with respect to all your subjects. And AMC is a lot about, clinical orientation and clinical application of the subjects that you have read. So I think you will have a good grasp on the uh, sessions and the questions that we are doing. You can start it. And at the same time, I would suggest that while doing your preparation, you can continue, with some kind of job like a house job, maybe in a lighter department or something, so that there is a recency of work and your CV continues to build. And once you clear your exam, so you'll have a good amount of experience to show on your CV and it'll help you with the job finding.
Yes. So, ma'am, should I continue in, means I want to take internal medicine for post graduation. So, should I continue houseman jobs in internal medicine only, or should I move on to lighter departments like there are many, like in India, there are many options.
Yes, like there is no particular, it's not like that you need to have the clinical experience in the same branch and you would be getting, the same branch in Australia. It completely depends on your CV and, what kind of job you do there, how do you network with people. So I would say that continue even if in a lighter department where you can continue with your studies and at the same time devote some kind of hours to your clinical work so that there is not a gap in your CV, which I would suggest. Because if you have a recency in your CV and there is no clinical gap, that
Yes.
always looks good on your CV, and it is going to actually your CV is not having any kind of a red flag for anybody to point it out, and it is a good CV, I would say, if you don't have a gap. So if you can do, you can always choose a lighter department. Obviously, a clinical department is given a
Yes.
preference.
Okay. So, any particular department which you would like to recommend? Should I go? Like
Any,
I'm
it
getting my
can be,
internship.
yeah,
Yeah,
it can
I'm
be
getting.
any. Like
Yes.
it also depends. Like if you want to like do like in emergency medicine, maybe you can do in emergency medicine or pediatrics or ICU. But again, like these would be hectic postings. So you'll have to strike a balance, on how you can balance your studies and at the same time, continue doing it. Maybe if you like have less number of hours that you need to do, or maybe like in your hospital that you're working, you just need to have like 3 day a week, where you have like these your rotation is for maybe 3 days a week or something like that. So it would
Yes.
work.
Thank you, ma'am.
You're welcome.
Okay, Dr. Vineet. Now, Dr. Faika Ghazal. Dr. Faika
Hello,
Ghazal, you
ma'am.
can unmute yourself. Yeah.
I am a third year student and my husband is now working in Australia. So when I can apply for AMC and how I can prepare?
Okay. Hello, Dr. Paika. You're a third year MBBS student.
Yes, ma'am.
Okay. So you can only apply to AMC. For that, we'll be needing your degree. So we'll have to wait for completion of, your degree. And because the first step is going to be verification with the ECFMG. So after you
No,
complete
ma'am.
your, yeah,
No, how I can, I mean how I can prepare, start preparation now for AMC.
for third year. Okay. So I would say that you still let your final year subjects, at least you'll have to study your final year subjects because the AMC questions are a lot of clinical based and clinical application. And if we look at the syllabus of AMC, 30% is medicine, 20% is surgery. Then we have women's health, child health. So all of them are majorly they are final year subjects. So I would say that when you enter in your fourth year, have a good reading, get a good concept of these subjects, so that when you actually start your preparation, it does not take much time and you are able to grasp things quickly.
Thank you, ma'am. And your channel is providing any lectures or offline courses or recording lectures?
Yes, ma'am. Yes, Dr. Paika, we are providing for the AMC coaching. So I think you can just drop in your phone number and your mail, and our counselors will be getting in touch with you, and they can give you a detailed, detail of the course that we're providing.
Okay, ma'am. Now I can send my number and email in chat box now.
Yes,
Yeah,
yes,
you
yes.
can
Please,
just
please
yes,
drop
you
in.
can just put it in the chat box, your phone number with the country code and your email ID, and our counselors will get back to you. And if you
Okay,
have
ma'am.
like
Thank
any
you.
questions about the details of the program, they'll be more than happy to share it with you.
Okay, ma'am. Thank you.
You're welcome.
Hello, ma'am.
Mm. Yeah, hello, Dr. Rakesh.
Uh, Ma'am, my questions are very basic. My son
Mm-hmm.
is pursuing it MBBS from Philippines, so
Okay.
he have to do internship, or without doing an internship he can register for MC exams.
Okay. Mr. Rakesh, I think in Philippines, we have a division of the course as like 2 years and 4 years, and wherein like you have clinical observership in the 4 years. Can you
Yeah.
just confirm if the course is designed in such a way
Uh,
for your
Actually,
son?
for my son, still it's for 4 years, and observership is there. But as per new guidelines of NMC, it might go till as 54 months and or internship. But it's very much unclear still now. So my concerns are that if it is of for 4 years, considering 4 years, so he would be
Mhm.
able to register in AMC, or he have to do internship in India or in Philippines.
Okay. Mr. Rakesh, it would actually totally depend upon the number of clinical hours that he has in the
Okay,
clinical observership, and if he's doing the observership, if they're actually having any clinical experience, or is it just shadowing that they are doing. So I
okay,
think the college, when they give the final certificate of the number of hours that they are spending in their training, if it
okay,
is considered at par with what is considered equivalent of internship, then most probably he won't be needing it. But if there is any less duration, then he'll have to cover for that duration. And also, if they're actually doing the clinical observership or just shadowing.
okay.
So we will have
How
to have a detail. Yeah.
do you have any idea about perpetual? If they are doing the shadowing or the real observerships using perpetual lab data, and it is registered in ECFMG also. The names are been showing
I
Australian
think
websites.
we'll have to check. You can drop in the details in the chat box, and our counselors can, look for the specific details, and we can have a session with you.
Yeah, definitely. I'll share my details to you, and I have a lot of queries also. So kindly give
Yeah.
your valuable guidance to me. Thanks a lot,
Sure,
ma'am.
sure. You can just put your details in the chat box, and our counselors will be contacting you.
Okay. Thank you very much.
Yeah.
Thank you.
You're welcome.
Okay, so Dr. Husnain.
Yes, ma'am. Ma'am, I have a question to ask you that I am a recent graduate of 2024 and I want to pursue my a career in Australia. Can you please recommend me, first of all, which licensing exam should I opt for? Whether I should go for PLAB or I should go for the AMC or whatever else, and what is the pathway to actually move to Luxembourg?
So, hi,
Rini, can you
good
just
afternoon. Yeah, good afternoon, Dr. Husnain. I think your voice was breaking. So, what I gathered is that you are a recent
Yes, ma'am.
graduate and
Ma'am,
you want some
mm,
clarity on which licensing exam to choose from, like
yes,
PLAB
ma'am.
or AMC,
Yes, ma'am. Yes,
right?
this is my question. This is my question. Whether I should go for PLAB or should I go for AMC and what is the pathway to actually move to Luxembourg?
Okay, sure. So, Doctor, I think both the licensing exams, they are choice would be very subjective. It would depend upon what you want to pick in as your final, destination where you want to settle. But if you ask me about the pros and cons of both, so I would say that AMC, I think, is easier as compared to PLAB. The exam, it is like you need
Yes,
like a
ma'am.
good 5 6 months of preparation, and if you give good amount of time to it, you can clear it, and you have very good like work life balance in Australia, and there are plenty of opportunities for growth. Right now, from what we are hearing in is that in UK there are not
Yes,
many
ma'am.
jobs, but again, like this is what we are just hearing. I cannot confirm that uh, because some people have mentioned it, but there is nowhere like
Ma'am,
official data or official statistics to confirm that. And whether the job situation will remain the same there or not is again another question. But for Australia, yes, we can tell you that it is a wonderful place to work in. A lot of our faculty is working there, and they have described the work-life balance is very good, and a lot of learning opportunities. The growth curve for the doctors is good, and the exam we can help you with the learning about the exam and the orientation and how to go about it. So if you could just put in your details in the Dropbox. And about Luxembourg, doctor, I think we will have to check because I personally am not sure about Luxembourg. So, Arindam, are
sure,
you
ma'am.
there?
Yes, ma'am.
Arindam, can you
Uh,
just help because
Yeah,
Ma'am,
yeah,
I'm
I'm here.
there.
I'm here. I'm here. I'm here.
Yeah.
But yes, talking about Luxembourg, I really need to check your credentials, and that is a country that we need to explore first. So we cannot comment as of now on Luxembourg.
yeah,
Yeah,
so you can
sure.
just drop in your details, and we can just actually have to check in the details, and then maybe we can have a discussion on that.
Ma'am,
And in
do
case you
we
need
have
any more
any?
clarity about the course, yeah,
Yeah, ma'am.
yes,
Ma'am,
doctor.
can you please, ma'am, very much thankful to you. Can you please tell me which sources and which groups or subscriptions should I actually sign for in order to prepare for the AMC exam in order to score with the flying colors and pass this test?
Sure. So, doctor, like academically, is committed to the success of our students, and we help
Yes.
them and provide them direction. So, I think you please put in your details, and our counselors will be giving you the details of the course, wherein we orient the students on, like, how they should go about their AMC preparation and how to strategize their exams.
Ma'am, very much thankful to you. May you live long and may you be the successful one.
Thank you so much, doctor. I wish same for you, and I hope that you succeed, and we'll be happy to help you. Thank you.
Thank you, ma'am. Thank you.
Okay, say next is Dr. Ankita Gidam. If you have any question, you can unmute yourself
Yes,
and
ma'am.
Yeah,
Yes.
hi, good afternoon, Dr. Ankita.
Ma- Hi, ma'am. How are you?
I'm good. How are you?
Ma'am, I'm also good, ma'am. Ma'am, I needed to ask about the specialist training in Australia if we clear AMC 1 and 2.
Okay, so
So is
right
it
now,
possible
yeah,
on scholarship
yes, doctor.
basis and all? Is it possible to do specialist training? On the scholarship basis and all, is it possible to do the specialty training? Sorry.
Scholarship basis,
Hello.
yeah, doctor. So, like for the AMC training, are you done with your medical graduation, or like have you done your MD or MS?
No, ma'am. I'll be completing in June. I'll be getting my degree in June. So I'm just waiting. I'm in
Okay,
Kyrgyzstan right now, so
okay,
I'm actually a bit confused about the specialty training.
okay.
So
So,
I've joined the
doctor,
course
like,
also. So
sure, sure. So, I can just highlight that for you. So, your first step obviously is going to be your document verification and creating your AMC portfolio and your Epic account. After that, when you give your AMC one exam, which is a computer adaptive test, and then you need to give your English proficiency. So after that, you have the option of either going for AMC2 or work-based assessment if you have any experience. So after doing your job, when you complete your 1 year of supervised training, you will be getting your general registration, and after that you can start with your residency there. And we don't have any scholarship programs per se in Australia. I mean, just to clarify to everybody present here, we don't have any entrance exam or any scholarships or tests or something like that. The pathway is pretty standard. You need to clear your AMC 1, then your AMC 2, and after that you'll be getting your limited registration for 1 year, and then your general registration. Once you get your general registration, means you have completely registered with the Australia AFRA, then you can start for your residency, wherein you are completing the residency in the department which you want, and after that you do what is called as a registrarship. So a registrarship basically is equivalent to a MD in India here.
Okay, ma'am. So we cannot pursue our specialty training, right, in Australia, even
No,
if
we
we
can.
want to.
Like it is, yes, we can. That is what I'm saying. After your AMC 2, when you get your complete registration done, you start with your residency. And in your residency, like you apply to the colleges that you are interested in. And after that, you are completing your registrarship and you will be there listed in their specialty register. So the college that you apply to is going to be a specialist college, depending on the specialty that you choose.
Okay, ma'am. Okay. Thank you so much. Okay.
You're welcome. I hope this helps.
Okay, so now I can't see any more raised hands. So all of you are please requested to, yeah, Dr. Yashdeep, you are raising your hand. Kindly unmute. And apart from that, Dr. Reddy, there's a query in the chat box from Dr. Saurav, I guess. If you can just revert that. Are you able to see the chat box, Dr. Reddy?
Sure. Yeah. I can. I'm just reading it.
Yeah, because there are some students who cannot talk and they are raising the query in the chat box. Apart from that, I would request each one of you kindly drop in your details in the chat box, and our counselors will connect with you and they will brief you one-on-one with the detailed information, whatever you are desiring for. So that's it.
So, Dr. Saurabh, with respect to your query, you are saying that after I get my Indian medical license, still my university ECFMG sponsor note will be required for appearing in the AMC exam. So, yes, for the AMC exam, the credentials need to be verified from ECFMG, and they will have to, the your degree verification needs to be done by ECFMG. Yes. So, yes, Dr. Yashdeep.
Uh, Hello, ma'am. I
Hello.
graduated last year, and hello, am I audible?
Yes, doctor. Yes, you're audible.
So, ma'am, I graduated last year, and I finished my internship in last year in June, and then I took a gap year, like preparing for NEET PG. And
Mhm.
so I have a gap year, and I have zero experience after internship. So what should I do? Should I directly give AMC and go for it, or should I gather experience, and how should I do it? Like, should I if I clear NEET PG, and should I join a college so that will count as experience, or should I just drop the idea of NEET PG and pursue for clinical experience? Meanwhile, I prepare for AMC.
Okay. So, Dr. Yashdeep, we have a lot of questions here. So, see, my first suggestion would be that you need to actually make up your mind that you need to go down the NEET PG pathway or the AMC pathway, because the preparation for both is going to be different. This IB clearly say it out to all our students, because NEET PG, the type of questions and the syllabus is different. No doubt both are like medical exams, so students sometimes do get confused that we can prepare both. But for AMC, you need, a dedicated time for preparation, because you will have to go about preparing in a different way, because you are going to answer the questions with respect to the Australian guidelines. You'll have to read some books about that, and some of the guidelines which are there from the government websites. And even the way how you approach the question is going to be different. The questions are like, they have 5 options. They are not like 4 options, and the questions are 6 or 7 liners. It's a long clinical scenario wherein you have to read the question and quickly answer it in 1.5 minute. So I would say sailing both 2 boats, I would say it would be tricky. So you first need to have a clarity. And in case like if you choose that, say I want to go down the AMC pathway. So if you have a clinical gap, I would say that it is okay. People do have clinical gaps. There is nothing like that, that just that 1 year is not going to define your medical career. So it is a long journey, and there are things that can be done to cover up that gap, you know. So while you are preparing for your AMC, you can always join an institute and start up with, like to show some recency of work, and you can do some courses like the ALS course, BLS course, for which you get certification. It is all about enhancing your CV. So I don't think that that just that 1 year can define it. We will have to work around how we can cover up that, but be sure that you will have to follow one path. I would suggest that.
Thank you so much, ma'am. Okay, I got it, and uh, I
Yes.
have points which you made, and thank you so much for answering all the questions.
Yeah, I would say, yeah. Think about it, and you can just, uh,
Hello.
put your details in the chat box, and our counselors can help you if you feel, you need another clarity
भैया
on
प्लीज मैं
this
कॉल कर दूंगी
particular
आपको.
process. Bharti, you're not on mute. Um, so I don't see anybody else who has raised hands. Uh, yes, doctor.
Hello, ma'am.
Yes.
Good afternoon. Yeah, I just completed my MD anesthesia here from
Yeah.
India. So
Mm-hmm.
I wanted to know what are the pathways available in Australia for me to further continue as a consultant, or what are the process I should go through, ma'am?
Okay. Doctor, could you please
That means
clarify?
about the specialist pathway. Like I'll
Okay.
complete my clear my AMC one, and what are the pathways that I can choose further to work
Could you
there,
please
join there.
specify how much years of experience do you have
I've just
after
completed
your?
my MD anesthesia now. Passed
Okay,
out
you've just
batch. It's
completed
been
it.
2 months. Yeah, yeah.
Okay. So, doctor, for you, I think since your experience is less than 3 years, so you'll have to go through the standard pathway. I mean, like you'll have to give your AMC one, and after
Okay.
AMC one, you can go for, um, you can choose between AMC 2, or you can go for work-based assessment, wherein you can show your experience, in anesthesia.
Okay. So,
Yeah, and
what is that
if you get a
exactly,
job.
ma'am? What are the steps that I have to go through if I have to go through work-based assessment?
Okay, so for work-based assessment, like it will be done only after you clear your AMC Part 1 and your English proficiency test.
Okay.
So there are like 23 hospitals throughout Australia that are listed, which provide these openings for work-based assessment. That is
Okay.
basically an alternative to people who don't want to appear for AMC2. So
Okay.
wherein like you're actually going and landing into a job, and then somebody is going to be, assessing how you do it, like the word
Okay.
says, word-based assessment. You'll be
Yeah. Yeah.
supervised, and then they'll be seeing your training and how you perform, and how are you able to handle the clinical scenarios. And based on
Oh,
that,
yeah.
they can offer you the position of RMO if in the work-based assessment they feel that you are qualified enough to practice in Australia.
Okay. After that, will I be like able to work as an anesthesiologist or a general practitioner? No? RMO post.
Uh,
That.
No, after that you'll be working as a RMO only. If you want to work as a anesthesiologist, there's no guarantee that you'll be getting it. That'll
Okay.
only happen. You you'll be working as a RMO, and then you can apply to the specialty college of your interest. And
Okay.
after you complete the desired fellowship, you'll be going on that particular specialty register.
Okay. Now, even though I go through this work-based assessment, there's no surety that I can work as an anesthesiologist over there.
No, ma'am. No, no, doctor. There's no surety. No.
Okay. Then I'll have to go through some other fellowship also, and then I'll be able to work.
Yes. Yes. Yes.
Okay. 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 Thank you, ma'am. Thank you, ma'am.
You're welcome.
Okay, so I guess now we can wind it up. Just leave your text with the in the Dropbox with your details, your name, your email ID, and your mobile number with country code. Our counselors will connect with you one-on-one and resolve all the queries and desired information. So that's it. Okay. So can we just conclude the session now, Dr. Rini?
Uh, yes, Bharti, I
Arindam,
think
are
we
we done?
can.
Yeah.
Yes, we are. We can conclude it over.
Yeah.
Exactly. So
So
all of you
please,
are
if
requested to
any,
leave.
yeah,
Yeah.
yeah, Bharti, you can continue.
Yeah, so I hope the session was really helpful for you and the queries are resolved up to our best of our knowledge. But still, we are open. I mean, you can just leave the details in the chat box. Our team will contact you by today, tomorrow, or day after. But definitely, someone will connect with you and resolve all the queries you have and the additional information that can be shared with you. Thanks for joining with us. Thank you and have a pleasant day ahead. Thank you.